is Angela Dara, and I'm a licensed physical therapist here at OrthoNeuro. Your physician has recommended that you review this educational video about non-surgical treatment for the cervical spine. Non-surgical treatment consists of 3 components. The first component is having adequate pain medication or pain control through medication or injections, and having what we call activity modification, not doing things that aggravate your neck and your upper back. The second component is having proper posture and good work habits with your workstation design. And the third component is to have a series of exercises to perform that give you some improved flexibility and strengthen the cervical and upper back musculature to help with your daily tasks. So the first component of exercise is to do some cervical stretching. Flexibility is really important to stretch the tight muscles of the neck to alleviate pain. So we're going to teach you several stretches. They'll all be held for 30 seconds, and 2 to 3 repetitions is the recommended dosage. So the first one I'm going to have you do is the anterior middle scalene. This will be for the right side. The scalene muscle is attached to the first rib and go up and attach into the cervical spine. So you're going to take your left hand and put it up on your collarbone, and then you're going to pull down on your collarbone. I'm going to have you tuck your chin in this position. There we go. And then you're going to side bend away and then rotate towards me. That's it. And then you can hold that stretch for your 30 seconds, 2 to 3 repetitions. And you can come out of that for me. And then the posterior scalene is going to be side bending away, looking down, and tucking your chin. Posterior scalene attaches to the second rib underneath the trapezius muscle. And relax for me. Now the upper trap, everybody has tight traps. They're the muscles that shrug your shoulder and elevate your shoulder. You're going to side bend away and put your hand down underneath your hip. That's it. And then side bend away, your other hand can go on top of your head. And then you're going to tuck your chin just a little bit. That's perfect. And then I'm going to have you lean forward. This gives you a little extra stretch on the trap. And again, holding that for 30 seconds, 2 to 3 repetitions. And you can come back out of that. And the fourth stretch is going to be the levator scap, which is a muscle that everybody has tightness in because of using the mouse and the computer or stirring something on the stove. So this one again is the same position. You're going to tuck down, and I'm going to have you put your hand under the chair, and then your other hand can go on top of the head, and you're going to lean forward until you get a good stretch. Okay, so this is how to stretch your pectoral muscle, and this is a single arm, so you'll do this on both sides. Again, just leaning into the wall and getting a good stretch. This first one is called Taffy Pull. So what we're going to do is, I think I'm going to have you turn around so they can see your shoulder blades. And what you have to do is make sure that you pinch together, and then you're going to start to pull. And you want to maintain that pinch. It's really important that they don't feel this in the front of your shoulder. That's good. We'll do a few more just for demo. In these, you want to do endurance again, so 10 to 15 repetitions, 2 to 3 sets. And there's various colors of bands, so this is a medium strength, and then you can progress to something that's a little bit harder. Good. And then the other one is horizontal abduction, so your hands will be straight out, face that way. Palms over, and then you're just going to, perfect. And then the arms just come out to the side. This one, you don't have to worry so much about keeping your scapula pinched together because it automatically occurs when you do this motion. Good. Again, 10 to 15 repetitions, 2 to 3 sets. Thank you. And then we'll go into the wall push-up. Make sure when you do this exercise that you don't extend your neck, so it's important to keep your chin tucked. And the next exercise is going to be forearms to the wall. And you're going to just do a single arm row. And this gives you some thoracic mobility, which is really important when you have a problem with your neck. And then you can do this side. And these you don't have to hold, just repetition. And then just do a single arm row with no rotation. So just pulling back, yeah. And then back to the wall. Both sides. 10 to 15 repetitions. This is the shoulder matrix to do some shoulder strengthening. So what you'll do is just both arms out to the front with the thumbs up. You always want to be able to see your hands when you do any kind of shoulder exercises. We'll do 5 in that direction, and then we're going to do what we call scaption, which is on the scapular plane. Nice. And then your uppercuts. And lastly, we're going to address the cervical musculature itself with some isometric exercises. And these are most important that you don't overload the cervical musculature too much to make yourself sore. So it's a submaximal isometric, so you don't want to push as hard as possible. So the first one is for the deep cervical flexors. So you're going to put your thumbs under your chin. And then what I'm going to have you do is pull your chin into your thumbs, tightening these muscles in the front. And you're just blocking, making sure you don't feel it in the back of the neck. And these you want to hold for a count of 5. Good. And then the second one I'm going to have you do is putting your hand on the side of your head above your ear. And with this one, I want you to push your hand into your head and don't let it move. That's it. And this works a lot better than pushing your head into your hand. And that can be done on both sides. Good. Again, a 5-second hold, submaximal. Then you can put your hands behind your head, and you can push your head into the back of your hands. This is nice to do in your car against your headrest. Good. And these 5 to 10 repetitions. And then I'm going to have you just face that way. And then this is what we call cervical retraction, which is just actually a mobilization, self-mobilization for the cervical spine. So you're just going to tuck your chin, and you can hold that for a count of 5, and then come out of that, and then tuck again. Good. All right. And then again, just to go over proper posture, which is really important, especially if you're at a workstation where you have to sit for a long period of time. Making sure that your knees are lower than your hips, so scoot out just a little bit. There you go. And then getting into neutral spine in the lumbar region, so go ahead and slump. So see here how there's a lot of stress in the neck. So what I'm going to have you do is sit up tall. That's it. And then find that neutral right there. And then you want to have your shoulders down away from your ears, kind of pinching your shoulder blades together. And then a good rule of thumb is to have an L or a 7 under your chin. So you want to be here and here, thumb on the sternum, index finger under the chin, and that's where your neck should be when you're looking at your monitor or doing any kind of work. And if you can't be in this position all the time, it's recommended that you at least once an hour try to get yourself into this good posture. Thank you for watching this educational video on non-surgical spine care for the cervical spine. If you have any questions regarding any of the components of this video, please contact your physician. And if you would like to schedule an appointment with a physical therapist, you can have your physician refer you. Thank you very much.